Welcome to the Cabral Concept, where board-certified naturopath and integrative health practitioner Dr. Stephen Cabral shares how he was diagnosed at the age of 17 with a life-altering illness and given no hope for recovery. It was only after studying and traveling all over the world did he discover how to combine ancient Ayurvedic healing practices with state-of-the-art naturopathic and functional medicine to fully rebalance the body and re-energize it with life. It's time to discover how to get well, lose weight, and finally feel alive again. And now, here's your host, Dr. Stephen Cabral.
Hi, everyone, and welcome back to the show. Glad you could join me here today for this Friday review. Excited that we get to recap the week, really go over the best of the week, what's been happening in the private practice, what's been happening in our global health-based community. I definitely want to bring you a lot of great research today, some of that absolutely new COVID-19 information. I want to also go over really the question of, do masks make a difference? And it's kind of changing over the past couple of weeks, so I want you to understand and really realize what the best recommendations are to this point. I want to go over the latest COVID-19 video, how it was actually blocked from Instagram, what it may have contained that was potentially not to their liking, but we are working with them on honestly getting that video back up, changing whatever we need to change if we have to, and then of course putting the uncensored version on the virus-based website, which I'll share with you in just a moment. So we've got a lot going on the show today. I've also been on, I think, another 3 or 4 interviews this past week. I try to never do more than 2 interviews or so per week just because of time and also really choosing what I think are great shows for you to potentially check out yourself. So without further ado, let's just dive right into the show. I know too many things I want to talk about this week in terms of what's going on in the private practice. Last week was a huge update with IHP, with our spring detox ending, with different giveaways. I mean, really a lot of fun over there. So what I want to share with you this week is this. Right now, there are many people dealing with a lot of anxiety, a lot of stress I've heard, and poor sleep because of, again, the uncertain times that we live in. And I get that because honestly, fear and anxiety come from the unknown, meaning that you don't feel in control of your life. And when you don't feel in control of your life, well, that leads to fear, and fear leads to anxiety, and it can lead to panic. That is why I'm doing my weekly viral-based videos, to share with you the exact statistics. Meaning, like, I'm taking them off of the global statistics of what's happening in the world, not what the media is saying. Because what the media is saying, and I'll share with you in just a second, is completely insane. I mean, it really is where they are getting these stats from, and we're letting people like mayors of certain cities in California, and we're letting people like Bill Gates, to be honest, who really should not be in the media talking about this virus. He is not a virologist. He is not an expert in the field. And he should not be the one that's on the news every single day talking about this, especially since, we can't go by what he's saying since he's funding a lot of these different things on the back end. So again, I just want people to be careful where they're getting their news-based information from. And I'll get to that in just one second. So just one thing I do want you to know is that what we're doing over at Equilibrium Nutrition, which is our global functional medicine-based company, is we're just listening to what do people want? How can we help? And then we try to save them money whenever possible. Like last week, we did something we never thought we'd ever do. And we worked with a particular company that we use for the minerals and metals test. And we said, how can we buy these in bulk at a certain amount? How can we get them for less? How can we give them to basically our community free? And that's what we did. So we did an amazing lab giveaway last week. Hopefully you're able to take advantage of that. And this week, what we want to do is we want to lessen the price of those products that we know will help with overall fear, anxiety, and really overwhelm. So you can find those by going to equilibriumnutrition.com and simply looking at the stress-based collection that we have right now. So you're going to find products there that help with sleep, like a liquid melatonin or a full spectrum magnesium. You're going to find Adrenal Soothe there. You're going to find, again, all sorts of different items there that are going to help with stress, that are going to help with mood. So I can't recommend enough checking those out. They're 10% through this weekend, 10% off. Again, you can just go to equilibriumnutrition.com. So let's actually dive now into the newest COVID-19 updates and also the insanity for what the media brings. So for example, I'm not going to name names. I don't do that. Well, here's the thing. A certain elected official inside of California said that California will most likely deal with a 50% infection rate. Okay, so what does a 50% infection rate actually look like for California? Well, California has about 40 million people living in California. So that means if 40 million people are in the state of California and 50% get infected, that means 20 million people now have COVID-19. Now, we know that 80% of the people were shown basically no symptoms at all. So if 80% of the people show no symptoms at all, that means now we're dealing with 20% of those 20 million people dealing with larger symptoms of COVID-19. Because that's what people should do. Break down the statistics. 20% now of 20 million people is 4 million people, right? Because 10% would be 2 million. 20% is we're looking at 4 million people. Now, the way that now again, but most people aren't going to look at this. They're just going to say, okay, I'm looking at it. I'm listening to a government official. They must be right. 4 million people, he's saying. Listen to this. Since COVID-19 has started, over the entire world, as of April 10th, there have been 1.6 million cases. So 1.6 million cases and 491 million in the United States. So somehow the elected official in California believes that we're going to triple the amount of cases just in a couple weeks in California alone, which is why I have to let you know that what the media is doing and what a lot of these elected officials are doing is they are simply grabbing media time. The media is interviewing people ahead of time to say, what is your stance on this? And they are asking people to be on the news that cause the most controversy and say the most outrageous things, which is why I ask you right now to still continue to calm the fears. I will, believe me, 4 weeks ago in my very first or second video, I let you know, listen, now is the time to prepare. I said that. We're going into quarantine, stock up on your supplies. I let you know, like I said, legitimately, this is what's happening. And I'm telling you right now that we are not seeing this jump that the media is showing. Now, is this a serious thing? Of course. We have 1.6 million plus cases. It will reach more than 2 million cases globally. I'm not saying that in the least that we should not be concerned. What we don't need to do is listen to these people preaching fear and panic. And I do hope that you remember their names. So when all of this is over, you will understand that they did not save the day. No, regular people doing social distancing and doing our best is what saved the day. But at no point at all was this going to infect 4 billion people around the world. And as a virus, some people have more of a natural immunity to it. They still get the virus and show no symptoms. This has never changed from the very beginning. This virus affects people in the same way in age category, just like the flu. And you can quote me on that. Because when I look at the curve side by side, you see the spike in those people affected the most over the age of 65. And a dramatic spike over the age of 75, which is exactly what COVID-19 shows. Approximately 45% of all cases of mortality happen to those over the age of 75. This is a dramatic issue for those elderly people. It really is. And it also does affect those people that are most immune compromised. Now, everybody can get the virus. Everybody. But it is those people that are most immune compromised or elderly that are having the greatest amount of issues, which is why we should not be causing fear and panic in the entire world. Now, there are aberrations. There is a potential for other people to have potential issues with this. So I'm not saying that that's not the case at all. We're doing the right thing. We're trying to, stay inside. We're trying to limit our contact, but let's not go overboard and certainly not feed into this media frenzy. All right, that's what I wanted to share with you on that. And again, these people, this is the worst type of self-aggrandization and fear-mongering that I've ever seen. And it's at the expense of other humans and other people. It's deplorable. It really is. So let's remember these people. Let's remember them And let's remember the media stations when all of this plays out in about 4 weeks from now, at the end of May, or essentially mid-May to end of May, when we see a dropping of this virus by about 10 to 15% weekly, which is what's stated based on what we've seen across the world. Because remember, the United States is being hit hard, but we've already seen what's happened in countries that this has hit first. So again, that's what I have to say on this. I do bring you weekly videos on the uncensored and unbiased truth, and you can find that at stevencabral.com/virus. That's where all the updates are. I still do recommend making sure that you're boosting your immune system, that you're not purposely exposing yourself to anywhere we could get the virus. And now let's move on to the discussion about masks. Okay, so this just came out in I believe it's the British Medical Journal. And what they said was that we know that unless it's an N95 based mask, that the actual filtration system is not small enough, meaning like the particle size filtered by regular masks are too large, meaning like the particles can actually get through the mask. However, wearing a mask is a good precaution, they're saying. So if you're going outside right now, a good precautionary measure would be to wear a mask so that you don't inhale as much of those particles as possible. They still believe that you can be exposed unless you're wearing an N95 mask. However, better for you not to transmit as much through literally your spit. And I talked about this, I believe, last Friday. I did it because it can't, and some people are considered hyper transmitters of the virus when they do speak because they have a little bit more particles come from their mouth, all right? That's a nice way of saying they spit a fair amount when they speak. There's a lot of particles that do come out. So a mask is a good precautionary measure, at least for now. I would hate for us to listen to people that say we can never shake hands again and that we always have to be wearing masks going forward. I will tell you for sure that I'm going to do all of the proper precautions and I'm going to make sure that I do my part to flatten the curve, as we say. But for sure, I'm going to be shaking anyone's hand in the future that is okay with shaking my hand in the future. And for sure, I will not be wearing a mask as long as that isn't necessarily, we have to instead of it be, as it's mandated. But, one thing I'll just will say to you is that I'm not going to be someone that gives up all of my civil liberties so that they can create fear and panic in a society. That's not the type of person that I will be. I stand for the truth. I recommend following specific recommendations when it is the truth, and that's why I have recommended social distancing, and I have recommended staying at home for the most part, but there is a limit to that as well. I recommend staying at home until we can increase hospital beds and ventilators to help those people most in need. And then I do recommend staying inside for those people that are most immunocompromised. But I'm certainly understanding both sides of the equation, and I've spoken about that before, and I wrote about it in my last Sunday email about how I do not want the entire world to collapse either, because neither is a good scenario. And if we do this long enough, you will see an absolute depression, and you will see potentially just as many mental health issues as well as suicides, etc., that come from this. So I look at all sides of the equation. I don't feel one side is more important ever than another. And I'm simply here to serve people the best of my ability. So that's why I'm saying right now, not a bad idea to wear a mask because there's not a lot of downside and it will stop some of those micron particles from being transmitted. So just want to share that. I will link up the BMJ article. It literally just came out on April 9th. However, I'll just let you say they believe it's a good precaution, fairly cheap. You could wear basically anything over your mouth, like a handkerchief or any cloth that helps. And of course, an N95 mask is still the best. Okay, so now let's go over something that I find pretty disturbing. They are trying to fast track tests, clinical trials of a drug called hydroxychloroquine, also pronounced hydroxychloroquine. And the issue is this. There are many doctors around the world saying that hydroxychloroquine or hydroxychloroquine combined with azithromycin has worked amazingly well for many patients. Now, for whatever reason, there have now been clinical trials set up and vitamin C is being used as a placebo. Let me tell you first why I believe that this is also a real life conspiracy. Now, I'm not a big conspiracy theorist, but I'll tell you this. We know, at least anecdotally from doctors in the real world using this on the front lines. I'm not a medical doctor, nor do I even promote pharmaceutical drugs. So if it's coming from me, then you know that it's unbiased because I'm saying, listen, when in need, these people seem to be getting results from this anti-malaria, RA or lupus autoimmune-based drug combined with an antibiotic, which you know that I'm against unless life-saving conditions. So here's the thing. Seems to be working. Why am I against it being done in a clinical trial against vitamin C as the placebo? Because we also know that countries like China and even in hospitals like New York are getting amazing results with using higher dosages of vitamin C. So if you put a drug versus vitamin C against each other, both of which have been shown to work, you're going to get not a lot of difference between the drug and the placebo. And that to me is done on purpose. You could use any placebo. You don't need to use vitamin C, which is what we've seen to be effective. So now you're telling me there's going to be two things that are potentially effective. The only good thing from this is that people are actually going to get benefits from either the placebo or the drug itself. So again, this is what's wrong with the world. It really is. This is what's wrong. You could use the hydroxychloroquine versus any type of inert white powder. You could use a rice flour capsule, which they'll often use. You could use anything in that. You could use a little magnesium. You could use baking powder. You could use anything. Here's the thing. This is why they are destining this actual clinical trial to fail. And that to me is ruthless. It is absolutely ruthless. So why would they want this drug to fail? And that's the thing. Why would they want this to fail? Because it is a pharmaceutical drug. Pharmaceutical drugs should be happy, right? Well, here's the thing. It is not one of those expensive pharmaceuticals. It's not one of those patented drugs that companies are going to be able to make tons and tons of money off of. And vitamin C, pretty cheap, right? Not very expensive. So this is the issue. When we are run by a world of people that put profit above people, we get this. But I want you to know about that. And this is why I want you to begin to listen to not just myself. I want you to listen to people that are really out there speaking the truth, because it's going to sound like heresy. It's going to sound like conspiracy theories, and it's going to sound like those people that are just trying to go against the grain. But I assure you, if the person's coming from a good place, that they are telling you the truth. And all I want you to do is I don't want you to accept that at face value either. I want you to look into it. Again, look up on your own hydroxychloroquine trial with vitamin C as placebo. And you'll see it. It's right there. And it's not the way that good medicine is practiced. All right. So I'm going to move off of that. I will link that up for you as well. The last one I want to share with you is this. It is another natural antiviral and now shown antibacterial that has been used for thousands of years, Ayurvedic medicine being one of those, and now being proven by clinical science. Why does this matter to me? Here's why. Because we know it works. We know it's worked for thousands of years, but modern medicine has said, no, we don't believe you. We don't believe you, even though we know anecdotally we see it working. Well, here's the thing. In time, all things are proven to be true if we see them working anecdotally. And that's the thing. They don't come from nowhere. When I learned this many years ago, over 20 years ago, when I got into the fitness field, we knew what was working with high-intensity interval training before high-intensity interval training was even a thing. Nobody was doing that 20 years ago. But not because it wasn't written in textbooks. But we knew it was working because we were doing it with our clients. And then, of course, it's proven through clinical trials and all of that. And you get the notice 10 years later, right? 20 years later. Well, here's the thing. I'm bringing you this. This was published on April 9th, super current, out of the University of Arkansas. And it says this. Antimicrobial properties of silver have been known for centuries. Technically, for thousands of years. Now scientists are seeking to better understand how the noble metal kills bacteria to help combat antibiotic-resistant superbugs. So now they're looking towards natural medicine because antibiotics are stopping to work so well because they're in our food sources and we give them out to too many people too often, especially for issues like viruses. Now, in a case like COVID-19, we're seeing secondary bacterial-based infections, which is why it may help as well. And they're also hypothesizing that it may actually help with the uptake of zinc. So there's many reasons. And again, I don't necessarily care, do a lot of other people as to exactly how it works if it is working. Let us help people now and let's figure it out soon, right? That's the goal. Well, here's the thing. So when I'm talking about silver, keep in mind, this is something like a nanoparticle silver. Right, so a colloidal silver, it's called, a sovereign silver. So these are tiny silver-based particles suspended in water. And what it does is, well, let me share with you now exactly how we know it works. And I'm just going to give you a summary. So I'll let you read the research. Again, it's out of the University of Arkansas. And let's see if I can give you specifically published in Applied and Environmental Microbiology. Okay. Again, I gave you the date, published in Applied and Environmental Microbiology. And it's titled How Silver Ions Kill Bacteria. All right, here's how it works. So we have bacteria in our body, and that bacteria contains DNA, right? Just like a virus. A virus contains DNA. Well, here's how silver works. It actually attaches itself to the silver ions, attach itself to the bacteria. So when it attaches itself to the bacteria, it actually begins to weaken and split the DNA strands. So we have this big molecule of bacteria. The molecule of bacteria has its own DNA. And what happens is the silver ions make that DNA inside of the bacteria fall apart, which means it literally kills the bacteria by destroying the bacteria's DNA at the source. Pretty amazing, right? And again, we've known these things for thousands of years. So I don't use colloidal silver a lot in my practice, but I use it sometimes. And I've used it sometimes with myself as well. We always have some in hand. We always have a bottle in my house, and we use it for conjunctivitis. Again, it's not a treatment protocol. Remember, I can't treat, I can't diagnose, I can't cure. That's not my job. That's a medical professional's job only, right? So doctor of naturopathy, functional medicine practitioner, integrative health practitioner, they can't say that, and I don't say that. What I'm saying is I work on the underlying issues here, right? Supporting the immune system, boosting the body's ability to heal, using natural products in order to strengthen the body and actually fight off dis-ease in its own way. So I can't do any of that, but what I can do is I can support the body and use natural means. So we always have it. You get pink eye, you get eye issues, we use that, okay? We also use it for if you're getting sick sometimes, we'll do that. It's not always my go-to, but it's part of my mold-based protocol, and it is something that I'll keep in my house that I will use for when I'm starting to get run down. And simply put, you can use it 3 to 4 times a day and use the serving size in the bottle. I will link up. Equilibrium Nutrition is not going to create our own colloidal silver. There are other brands that I love. People oftentimes don't know this, but we promote all of functional medicine. So when a company does and makes a product better than we do, we use their product. That's how I believe we should be serving people the best. And plus, you don't need to do everything yourself. Like when I recommend acupuncture, I don't do it myself. I recommend out for that. Same with chiropractic, same with massage, same with anything, as I recommend out for the best of the best. So hopefully that was helpful. And what I'm going to do is I'll link that up. I'll also link up, again, my favorite brand of colloidal silver that I'm using right now and that I use with my own family. Okay, I've got lots more research. We're going to keep it at that for today, but I would be remiss if I didn't name the podcast that I've been on over the past couple of weeks. The first one is this, the Elite Man Podcast. So I've been on the Elite Man Podcast with Justin a couple of times now. Justin is an amazing host. He's an amazing wealth of knowledge as well. He's really been accumulating his knowledge of health over the past couple of years. You can check out his show. He interviews all sorts of different successful people in their line of work. And he was nice enough to invite me on to talk about COVID-19 and to do your best to protect yourself and your family. I was also on Your Own Magic podcast with Raquel. Raquel Mantra, I believe is how she pronounced her last name. Raquel, again, another amazing individual, talked a lot on our podcast about spirituality. If you love learning more about astrology, spirituality, and really how to live your best life, it might be a great show for you to check out as well. I was able to talk about a lot of different topics on this particular podcast. And of course, the virus COVID-19 and boosting your immunity was one of those. So really appreciate Raquel having me on. Again, great person, great wealth of knowledge as well. And the last show I was on, it was actually on 2 weeks ago, was with Elliot Rowe, and his podcast is the A Game Advantage. So this podcast is very different than a lot of shows I've been on previously. His show is actually teaching people how to use their mind to overcome anything in life and actually work with a lot of high performers in order to help them or share their stories that can relay, I think, to all of us out there. So I was grateful to be on his show as well, talking about COVID-19, again, talking about boosting immunity, what we need to be doing right now, and also what we should be doing in the future in order to protect ourselves, our family, our overall health. One thing that you may not know about Elliot Rowe, because I've gotten to know Elliot quite well over the past couple months, is that Elliot is one of the, well, we'll put it this way. If he's not the number one, he is one of the top hypnotherapists and performance coaches in the world. And you probably have not heard about Elliot before, and that is because he keeps a low profile, but he works with the best of the best in their field. He is working with world champion poker players. He's working with mixed martial artists. He's working with athletes. He is working with executives and CEOs. He's working with people that need to get from their best to the very best in the world in order to serve and help the greatest amount of the population, or to be the best in class in their sport, whatever they may choose to do. So Elliot has a great app as well, which I believe is free to download, called Prime Mind, and I'll link that up as well. Elliot's a wealth of knowledge, and I'm really excited to be on a lot of these shows because I get to speak with great people, really connect with them, and understand too a lot about their world and how they're helping people. So hopefully these 3 shows serve you well, that they are useful in terms of information. And as I always say, if anything we're doing right now is helpful, please do feel free to use it yourself and then pass it along to anyone else it may serve. Take care, everyone. Have an amazing weekend, and I'll talk to you tomorrow on our first house call of the weekend. Did you know that the body really only becomes sick or imbalanced in only 2 ways? Over time, you become deficient in vital nutrients, and you also accumulate toxins internally and from the environment. As those nutrients diminish and you increase your total toxic load, your body then begins to show the first signs of dis-ease. It's actually quite predictable, and the good news is that if we know how you began to fill up that proverbial rain barrel, we also know how to empty it to begin the healing process. I was fortunate enough to learn this ancient healing process from my mentor after suffering from debilitating diseases for close to a decade. It was only when I began to implement these techniques did I finally overcome my illnesses and go on to live a life of energy and vitality that I now enjoy. I'd like to share with you now what I discovered after traveling all over the world and how to combine the best of ancient healing wisdom with state-of-the-art science. Allow me to teach you exactly how I've been able to help over 250,000 people to empty their rain barrel and begin to transform their body and lives into what they've always hoped they could be. To get your copy of the international bestseller, The Rain Barrel Effect, simply go to StephenCabral.com/rainbarrel.